Hello there, I am Dr. Purnendu Roy. I am a surgeon in Genesis Hospital in Kolkata. I did my medical career from JIPMER, Jawaharlal Institute of Postgraduation Medical Education and Research. That's in Puducherry. Today I'm not going to talk about any disease or very serious things. I'm going to talk about few of my experiences. One of the things that I used to feel very depressed and bad about, that when I used to get up in train in Coromandel Express to go to Chennai, to go to college, everybody in the train co-passengers used to ask, what do you study? And I said, I study M.B.B.S. medicine. Then they will ask, where? And I would say, JIPMER in Puducherry. And some of them would show such strange expression that JIPMER, where is it? Is it in Aurobindo Ashram in Puducherry? And I used to feel so bad. Why is it that my co-passengers have never heard? JIPMER, such a premier institute. At that time, there were 25 seats in all India competition from the whole country. But what made my day, once the train will cross Vijayawada or Voltaire, and then when these people from south will ask, where do you study? And I would say, I studied in JIPMER in Puducherry. Then immediately say, ayyo, neenga JIPMER la parikiriya, romba nalla institute. And that time I used to feel, yes, at least some people have heard about JIPMER. Today I'm going to talk about how not knowing the local language, that is Tamil, created some real funny situation during my clinical days. After finishing preclinical years, when we were posted for the first time in clinics where we see patients, in surgery posting first day, we were 14 of us in our batch and none of us knew Tamil. So we went and met professor and professor said, just go outside, pick up any patient, take to the examination room, take history, examine the patient, and in 20 minutes time, I will come and take a class on the topic. We all had everything written down because we did not know the language. That is, what is your name? Ungalukku per enna? Where do you live? Ungalukku oor enge irukke? How old are you? Ungalukku vayasu evlo? Now, like that, we had everything written down. But when we went out and picked up this young guy and took him inside the room, he was resisting like anything. He kept on saying, ayo vanda, no, which means no, 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 no. And we couldn't understand that why was he resisting so much. So, when you don't know a language, you tend to speak English in broken way. So we were trying to explain, we student, we become doctor, you help, we examine, we become doctor. In spite of that, he was still resisting, but there were 14 of us. We overpowered him. We managed to push him inside the room, and then we were taking in our usual fashion the history. Ungalukku enna kashtam irukke? What is your problem? Unfortunately, we knew how to ask questions because they were all written down. But whatever he was saying, because we didn't know Tamil, we were not very clear what he is trying to tell us. Somehow or the other, we managed to understand that it has something to do with blood while he passes stool. So it was rattam varada velike povambadi, which means while passing stool. We had one over-enthusiastic friend in our batch, and he somehow understood that this must be something to do with piles, hemorrhoids. Otherwise, why blood and rattam? So immediately we opened the chapter of piles in our surgery textbook, how to take questions. And we tried to ask, because those questions were not written in Tamil, somehow after seeing we realized that we need to do examinations. And for examination of piles, one needs to do a rectal examination. So somehow or the other, we tried to tell, we will do checkup examinations, no pain, no worry, but he was still resisting, ayo vanda, which means no. But then he was alone, it was examination room and there were 14 of us, very enthusiastic young students who want to become a real good doctor. So we managed to take his trousers off, we put on gloves and we wanted to do the rectal examination. So we did the rectal examination, one person was reading it out that what to feel. But this was the first time we were putting a finger into the rectum. None of us knew what to expect. So this went on for a short period and then the next part of the examination was proctoscopy. Now proctoscopy is a small steel hollow tube which you put inside the rectum and with a torch you have a look whether there is anything inside. Whoever knew how the inside of the anal canal or rectum would look like, but we did manage to put the proctoscope inside his rectum in spite of a lot of resistance, and that's the time when my professor came inside the room, who was a Tamilian himself. As soon as the professor came in, he jumped out of the bed with the proctoscope in his rectum and jumped into his feet and held his feet and said, "Swami, neenga paarenga enna pandringla," which means, "Sir, please see what these people are doing." So my professor was very nice and he tried to explain to him in Tamil, means why are you so scared? These are students, doctor means they are all students. If you don't listen, how will they become a doctor? Then immediately that fellow said, "Swami, na evlo thara solre, naan illiye, yen appa ka piles irke," which means I told them so many times, it's not me, it's my father who has got piles. But neither of us understood, and for the last 15 minutes all of us were doing rectal examination and proctoscopy in his rectum. Now this is one thing which we should realize, how important it is to learn the language whenever we are going to the patient. Another incident that I want to tell about how not knowing the language can put one into a very difficult situation. We had a professor who used to be very strict and sometimes really harsh on students, and many of us did not like him. And probably some of us was waiting for an opportunity, like how to get it back for all the things that he has said to us. One day in the ward, he wanted to examine the submandibular gland and he put his gloves and he wanted to put his finger inside the mouth and feel for it. Because he didn't know Tamil, he asked one of the students, "Could you please explain to the patient that I am going to feel with this finger and it won't hurt. Just tell him to just bear with me." Now this person knew he was a Tamilian. So what he did is, he thought, this is my chance. So he told the patient, in the doctor or a viral pore paatha poringla, which means this doctor is going to put your finger inside the mouth, and then he said, muscle strength paaka poringla, which means he's going to check your muscle strength. The viral potambade udane neenga nalla karchatunga, means as soon as you put your finger inside, please bite as hard as you can. And all of us understood, and we somehow managed to control our laugh and giggling. The moment professor put his finger inside the mouth, the patient did nicely, and he started screaming, and he said, "Jesus Christ, didn't you explain to him?" So immediately my friend said, "I did in clear Tamil. Maybe he doesn't understand Tamil very well." Another day, our professor got a reference from psychiatry ward, and psychiatry ward, one of the inpatient had severe pain and difficulty with the knee joint. So my professor took all of us to the psychiatry ward because professor could not speak Tamil. So he went and he asked us to take a history. So we were taking the history in Tamil and then explained that these are the problems. In Tamil, knee means you. It's like ning means a. So now when we say ni varila, which means, are you coming? Ni saapitacha means, have you eaten? Now this professor went there, we took the history and he was trying to examine, and this patient was resisting, not allowing the movement. So he meant something that he is examining. So he looked at him and said, knee loose, knee loose. Now knee loose in Tamil would mean that you are crazy. So he got so mad, he said, "Naan lose? Neenga the lose, unga appa lose, unga amma lose, ungalukku ella family lose," which means you're calling me mad? You are the one who is mad. Your father is mad. Your mother is mad. Your whole family is mad. This is the reason why it is important that when you try to communicate, one should know the local language. Like many of us from this state in West Bengal, when we go to North or any other places without knowing Hindi, or we go to South without knowing Tamil, we land up in a lot of times into such funny situations. Today we thought we will digress from medical, pure disease-oriented things, and that's why I shared with you. If you enjoy this, please share with your friends, subscribe to my channel, and keep watching my channel to know more about such incidents and more about medical problems and health and education.